I'm very, very grateful for the invitation to come and talk about measles and the vaccination program, and just a little bit more about not just the disease, but why it's important to get it. And after I give the presentation, I'll be happy to entertain questions. And if there's anything that comes up along the way and you want to interrupt me and ask a question, feel free, and I'll try and answer it to the best of my ability. So. Measles. I think that this is a relevant topic just to bring up now because of the increase in the prevalence of it. It actually seems to be dying down, thank God, a little bit now, but over the past year it's been getting more and more prevalent. And as many of you know, it's become more prevalent in certain Jewish communities and stuff like that. And we're really trying to educate people on the importance of doing it, on the importance of getting checked as an adult, because we found that even people who were vaccinated may not still be immune. So this is just a general informational thing. So as I said, measles, it's not just a little rash. It's a respiratory disease. It's caused by a virus. It's probably one of the most contagious respiratory illnesses that exist. In other words, the ease of transmission from one person to another can happen with very minimal contact, which is really important to understand. It's been around for over 1,000 years, and millions of people get the disease and thousands die from it every year, more in countries outside of the United States up until recently. Since 1963 or since 1968, measles vaccine has been distributed throughout the United States and Canada as a standard vaccine schedule for kids and adults. And until 2000, it was essentially eliminated. It was considered no longer an epidemic in the United States, and this was, mainly because of the vaccination programs. So the symptoms are, in the beginning, very nonspecific. So a lot of the time you may not even know it's something specific to measles. You get the cough, the runny nose, itchy, watery eyes, the high fever. And then there are certain stigmata of measles that present itself within a few days of being infected. There's specific spots you can get in your mouth. I'll show you a picture in a minute. And then the rash that is the sort of classic presentation that goes from, head to feet. Actually also sort of atypical of measles is that the fevers can really go quite high, up to 104 degrees, and that's a little bit unusual even for a child or an adult. You get that high, you usually call your doctor. I think I mentioned most of this. Just in terms of the way it evolves, first you get the fevers and the runny nose and the cough, which don't really seem suspect of anything, and then about 3 to 5 days later, maybe even a bit longer, you start to get a rash from your head. It spreads down sort of this way, and then you get the little red bumps on top of the rash. And then sometimes it can become confluent, which means they sort of join together, right? Where you have the discrete lesions plus they become one big red lesion. You can also get these specific marks inside of your mouth called, I think I have a picture here, which is really hard to see, called Koplik spots. It's like these, really it's tiny, like tiny little white spots inside the mouth. And this is what it looks like as it starts to spread. So how serious is it? For children that are under 5 and over 20 years old, the risk of complications is much, much higher. The common ones are ear infections, GI illnesses, diarrhea. More serious complications are pneumonia and encephalitis. And encephalitis is when you get the virus in your brain and you get brain inflammation. Now, people kind of more commonly know about meningitis, and there's actually a pretty significant distinction. Encephalitis has a lot more potential complications. It's a lot more serious. There's a lot more neurological problems that are associated with encephalitis. And there's a very rare long-term complication called subacute sclerosing panencephalitis, and it's fatal. It actually is, I did my senior thesis in medical school on a case study of SSPE, and it's devastatingly heartbreaking to see like a 7-year-old develop this disease. it's their cognitive function completely is dissipated. They can't communicate verbally. Their motor function, their sensory function, basically all normal functions of daily living get worse and worse and worse until they and it's fatal. And I don't know if you guys remember, there was that flight attendant on an El Al flight who contracted it and ended up being in a coma. I actually don't know what happened if she's. She did pass away, right? It was like in December she passed away. And again, that's it's something to be aware of, that the older you are, the worse the complications, or the younger you are, the worse the complications.
The SSPE is a complication because of the measles, or it's something you contract because you're more susceptible?
No, it is a specific result of the question was, is SSPE a complication sort of separate from measles, that you become more vulnerable or susceptible to it because you had measles, or it's a direct result of measles? It's actually a direct result of measles. So like if you never had measles, you would not get SSPE. So, any other questions on that? Yes.
So it's because you didn't get treatment right away, or it's just, it could be that you got treated the day of and it's just your body?
But there is no treatment.
Right.
So in other words, you weren't protected against the measles.
Right.
You contracted the disease, and it's a long-term complication. It's not inevitable. I mean, most people don't get SSPE, but it is a potential long-term complication of it. Did I repeat the question? The question was, even if you treat it, the question was, even if you treat it, can you still potentially get it? And the answer is yes, because there really is no treatment. It's supportive care. It's like chicken pox and all those other things that most of you are too young to remember that you get, and then, it just goes away and you have some rashes, but measles is much worse than that. Yes?
If you're not born in this country, how do you know if you got that shot?
So I'm actually going to talk about it in a minute, but I'll just briefly say that as a standard rule, we can check it in your blood. But let me get to that in a second, okay? And then we'll do questions at the end as well. So as I mentioned before, it's one of the most contagious diseases. Up to 90% of people that the infected person has contact with can get the disease if they're not already protected against it. And it's just through a cough or a sneeze. And you can even spread measles before you even have symptoms, like before you get the fever, before you have the rash, any of that, and then even after. Like the virus sheds in your body for quite some time before and after the actual disease process. Oh, that's right. So this is just a reiteration of that it stays in your nose and throat for a long time. Like before, it's in your nose and throat, it colonizes there, then you have the disease, and it stays there for a little while before and after the symptoms resolve. I think that was a duplicate. So just in order, to clarify the other question, many other countries still have measles. It's not standard to do the vaccination programs. And if you're unvaccinated and you travel to other countries that have it, you can contract the disease, and then when you come back, you bring it to the United States, which is what happened with these several cases on these planes. So this is just a little graph. I added this yesterday because I thought it was a good illustration. So in 2000, it was essentially, like I mentioned before, completely eliminated from the United States. Now, if you look here, so this is the number of cases of measles by month in the year 2019. And this was updated, I did this on September 5th, okay? And so as you can see, the numbers are very, very high. It peaked in April, and it's been getting lower, like I mentioned before, down to 24. Now, these are the numbers of measles cases by year since 2010. And it peaked in 2014, and it's double that in 2019, 1,200 cases of measles, which is astronomical for a disease that was completely eliminated 19 years ago. And I mean, I'm not really talking about it that much here, but there's a handout in your packet about the whole not the controversy, but more like the speculated association between autism and the measles vaccine, which is been completely disproven time and time again. There's, I think, 25 references on the article that I gave you that have disproven that theory. But the idea is that when people became scared that there's a connection or a causal relationship between the MMR vaccine and autism and other neurological problems, they basically stopped vaccinating their kids. Now, the theory that Dr. Wakefield proposed was that there was like a problem with the digestive system that allowed that the vaccine with its level of mercury made the people more susceptible to getting other types of neurological disorders, including autism. Now, this has not been reproduced, and it's actually been disproven. I think it was 25 times since then. He's been, he's in jail. The article was retracted. He's lost his medical license, and he admitted to falsifying the data because there was, I believe it was there was a company that wanted to do a class action lawsuit against the vaccines. So they manufactured the data. So just to be really clear, there is zero evidence between any connection between the measles vaccine and autism or any other neurological disorder. And of course, I can answer more questions afterwards. So if you get the two doses of MMR, you're 97% effective at protecting yourself against measles. Even one is 93% effective. So, and as we mentioned before, it's 99% almost eradicated since before the vaccines. Yes?
How long does it stay in your body?
So the question was, how long you're talking about the vaccine, like the immunity, how long does it stay in your body? So that's actually a really good question. And what it's not very clear. There is not 100% answer on this. And that's because over the years, as we've been studying it, we realized that some people lose their immunity to titers, which brings me, I'm glad you asked that question, to one of the most important points with why I'm coming here and speaking to adults as opposed to, for the children. And that is, I'm encouraging people to go to their primary doctor. You're welcome to come to me as well. I will verify the immunity in your blood. It is a simple blood test, and it isolates the antibodies or titers, which are the indicators for immunity for us. And then we know whether or not you've lost your immunity to measles, mumps, rubella, chickenpox, a lot of different things. And I've found that it's a lot more common than I thought. It says later in the things that usually the written proof on your yellow card that you get like as a kid for immunization is enough to document immunity. But the fact of the matter is that more recently the evidence has suggested that you need titers to really prove that you're immune. I mean, not for your school, or actually that's not true, because for schools now they're requesting titers from me when I fill out paperwork. If I have the yellow card, that's not enough. They want the actual titers as well. So these days it's becoming less and less acceptable just to have the proof of immunization in terms of like the dates that you got immunized as a kid. So my answer is, I'm not 100% sure, and I suggest that people get checked. Yes?
Sorry, just one more question.
Sure.
So you're hearing a lot of people who are anti-vaccines, and they're going to tell you, well, when was the last time anybody had polio? It was completely eradicated. So you're saying 19 years ago, measles was completely eradicated?
In the United States.
Oh, in the United States.
Only in the United States.
So certain things that we vaccinate against are really almost completely eradicated?
That's correct.
So if I want to answer back to these people, where we find, they're going to say it's not around because it's eradicated, so why do I have to vaccinate?
Right away.
How does it come back?
So
Where can somebody pick it up if it's not around?
So the question basically is that if measles was eradicated in the United States and almost virtually, eradicated in the United States, then how do people actually get it if you live in the United States, right?
Well, I understand because you said someone can bring it.
Yeah.
But something like polio, like something that you really don't see anywhere anymore, or everything you can see.
I'm not sure I can addend this lecture to include polio. I think that still in other countries polio exists. A lot of these diseases, they don't have the financial resources and stuff like that to actually do the widespread vaccinations like we have here in the United States and Canada, and also mostly in Western Europe and stuff like that. So just a brief reminder, hold on one second, just one second. The children get their their vaccinations from a year to 15 months, and then they get a second one between the ages of 4 and 6. If you have not been immunized, or if you get checked with your doctor and you don't have the titers, then you still require 2 vaccinations given about a month apart. Same thing with any adult born after 1957 that doesn't have, before that actually people got measles and may be immune to it anyway, even if they weren't vaccinated. And then again, the same thing with international travelers, or basically anybody who doesn't show evidence of immunity in their blood should get the 2 booster shots about 1 month apart. There was a question back there?
Can't you get the measles from the shot? Isn't that a side?
So the question was, can you get the measles from the shot? The answer is essentially no. So the measles vaccine is a live attenuated vaccine, which means that they basically, there's like a teeny chance. It's like 0.1%, and don't quote me on that number because I'm not actually 100% sure about the number, but it's almost a negligible percent. What people get from the measles vaccines occasionally is like a mild sort of what would appear as a viral illness, like a fever, or even just some redness around the site of the injection. But the likelihood of getting the vaccine, measles from the vaccine is virtually negligible. I'm not saying it's impossible, I should correct myself, but it's virtually impossible. And then of course you have to look at I understand the question, but the risk of getting it if you're not vaccinated is, 100-fold more. I mean, there's no comparison between the risk of getting it from not being vaccinated versus getting it potentially from the actual vaccination. I'm sorry, what?
How is the risk so high if no one in the United States has it?
But now they do. Yeah, that's the problem, is that it still exists in the world. The measles vaccine is not, is not eradicated in the entire world. It's only was eradicated in the United States. And there's still, there's a lot of influx of travelers from other countries and immigrants and whatnot coming into the United States that aren't necessarily immunized and may even be carrying the virus when they come in. And that's how it starts. But the only people who actually contract it are the people who aren't protected against it at that point. So just, there are, this is a little small for me to read, but basically, there are people that should either not get the vaccine or wait, people who are on chemotherapy, people who are on immunosuppressive therapy, people who have cancer. You really shouldn't get it if you're sick or you have a fever. You should wait until you're better. If you're pregnant and it shows you don't have the immunity, you have to wait until after you have the baby. If you find out before you get pregnant, you have to wait 4 weeks to try to start getting pregnant. And then obviously HIV and other things like that. So, or if you've had an allergic reaction. So those would be reasons to wait. So these are just some resources. I believe that they're in the handout that I gave you. Just in terms of, I feel like I missed a slide though. There was something. Wait, there was something. I guess not. Well, I think that, the question that keeps coming up again and again is that, from you and not just from you, but from other people as well, is, how are we getting it back again, if it was eradicated? And the problem is it wasn't 100% eradicated, and it certainly wasn't eradicated in populations outside of the United States, and that's really how it gets here. So, yeah, sorry.
Oh, sorry. So should I tell my doctor to just take a regular CBC blood panel and that's what will check it, or he has to check specifically for the MMR vaccine and
Right. So
do doctors have their own protocol to do it now because of what's going on in the United States, or I still have to tell her?
So the question was basically, how do you go about asking your daughter to check for to see if you're immune? No, it's not a standard CBC. Now, some people, I will say for the past I've been doing this, what year is this? 2019. So since 2005, for the past 14 years, as a standard protocol, when I first meet a patient, I always verify the immunity because I have found so many people have weaned in their immunity and require a booster shot. But you would, I will say that most primary care doctors, especially people older than me, probably don't check that standard. And you would have to actually ask, like, can you please check the measles titers to make sure I'm still immune? Because it's a separate blood test. It's not something that you would get like on a routine annual unless you requested it.
It's called titers?
Titers, like TITERS. Yeah, you can say MMR titers or chickenpox titers. You know, basically anything that you've been immunized against, we can verify in your blood.
Can I ask you another question?
Sure.
Like if someone's coming in from another country, does that pediatrician make sure that those kids have all those shots? Like, is that like a standard thing to do?
The question was, when people are coming in from other countries, do the pediatricians verify their immunity? I mean, I'm not a pediatrician, so I can't tell you what pediatricians do for immigrant children. I would imagine that they do because it's sort of standard practice for kids to be, for the recommendations. Yeah, for the schools, you need proof of immunity. That's a whole other presentation about the schools. So I'm gonna refrain from answering that question in general because there's a lot of evolving, issues with that, in Brooklyn and Rockland County and stuff like that about whether or not you're allowed to go to school if you're not vaccinated. Like you needed to get a medical excuse or a religious exemption and stuff like that, and that's sort of changing at the time. Hold on one second. Yes.
I'm sorry, maybe I missed that part. How is it transferred from the individual to the next?
I'm sorry, can you speak up just a little bit? I couldn't quite.
Yes, how is it transferred from one individual to the next?
The question was, how is measles transferred? It's a respiratory virus, so it's in your nose and in your mouth. So if you cough or you sneeze, and it's colonized in your throat. So basically, even minimal, like I could theoretically, it's a very powerful virus. So even the ladies and gentlemen in the first row, if I had, God forbid, measles, like they could potentially get it from me from here. Yeah, there was, yes. But don't worry, I don't have it. I'm vaccinated. I've checked.
Is it safe for a pregnant woman to be around children that are not vaccinated?
I would say.
I mean, that are vaccinated. I know somebody, she's pregnant, but she won't vaccinate her kids. She believes it's...
Okay, so the question was, is it safe for pregnant women to be around unvaccinated children? Is that the question?
I think everybody should need to be around unvaccinated children.
I mean, but theoretically, if you're vaccinated, you're protected. So even if you're around somebody who's unvaccinated, but you're vaccinated, you should be okay.
Is it protected with you?
Well, that's the problem, is that the fetus could potentially be exposed if the children contract measles. Yeah, not. I mean,
as
but.
a person, it's the baby.
And that's not really 100% because the mother has immunity. So, I'm not actually sure. I don't even want to say that 100%. I know there is a risk to the mom and to the baby. I'm not sure what the mechanism of that exactly would be since the mother has, assuming the mother is vaccinated and she has circulating antibodies, which are the proteins that protect you against the virus, right? That what you get when you're vaccinated initially should circulate through the baby and protect as well. So I'm not sure exactly what the mechanism of that would be, but I mean, I know that there is a risk there. Yes?
Spinning off of that, isn't it on the insert for the MMR vaccine not to go near children?
Wait, I'm sorry, could you repeat the question?
When you get the MMR, aren't you not allowed to be near children, pregnant people, and cancer patients? Aren't you not allowed in the cancer hospital if you have the vaccine?
So the question was, if you've been vaccinated with MMR, are you prohibited from being around certain people like...
After you get the shot.
I'm sorry, let me just repeat the question. If you've been vaccinated, are you not allowed to be around cancer patients, pregnant people, or children? That was your question?
When you get the shot.
Yeah, for a certain period of time. Not really, no.
Okay, because
Yeah.
most hospitals will let you know not to come in if you have it. Like it's on their website. It's like, I've seen it.
So, I mean, it's...
Why do they say that?
Assuming because it's live.
I think it's because it's a live attenuated vaccine, like I was saying before. Like there are certain vaccines that we give that are called inactivated, which means like it's a totally dead virus, and they have use certain surface proteins on the virus itself to elicit the immunity in the person. But MMR, chickenpox, and I'm blanking on the other live shingles, and which is basically chickenpox, are live attenuated, where they've removed the virulence, like the strength, the ability to actually cause the infection from the virus, but it still stimulates the immunity. So again, I think it's more of a safety precaution that if there is even minuscule shedding of the virus from the vaccine, that you would want to protect the people who are most susceptible to it. I don't think that applies to kids. I mean, cancer and immunotherapy patients, yes, but I mean, parents get vaccinated, you know, all the time. But I mean, of course, the assumption is that the kids are vaccinated too. So it's a little bit of a, I think the question would, the answer to the question would depend on whether the person that they're around has already been vaccinated, right? So it would be more that you should.
Immunosuppressed people.
Right, well then, yeah, you should be, I mean, yes.
I would assume it's more hospital protocol, just as a,
Yeah.
just in case, but I don't think there's any specific, medical correlation.
Yes, in the back.
Easier to tell you.
I've heard that the M1 vaccination,
Caution.
it has some development delays for children having the vaccination.
Wait, I'm sorry, can you repeat the question?
I've heard that the vaccination, the MMR, can give development delays to children.
Okay,
Is
so
that true?
absolutely not 100%. We mentioned it. Oh, I'm sorry. I forgot to repeat the question. The question was, can the MMR vaccine lead to any developmental delays? And the answer is categorically 100% no. I actually gave a handout in the folder, if you didn't get it, that talks a little bit about briefly the history of why there was any sort of a link between MMR and developmental delays and autism, and you can read it yourself, but the theory was completely debunked. There is zero scientific evidence to, I cannot emphasize this enough, there is absolutely no evidence whatsoever in any forum that there is a link between the MMR vaccine and developmental delays. I think there was some confusion, even outside of the Wakefield study, because a lot of these things are being diagnosed because our ability to detect things like autism, Asperger's, different types of developmental delays is better now than it used to be, that we're picking up on those stuff when the kids are younger, like a year, year and a half, 2 years old, which is around the time that they're getting these vaccines. So people were making a mental connection even though there really wasn't one. I'm sorry, what?
The Hannah polling case?
I'm not familiar with that. I can't really comment. Yeah.
Do they still add mercury into these shots?
So that's the question was, do they still add mercury into these shots? So no. I should have printed up, there's another article that I meant to print up for you guys about thimerosal, which is the preservative that is used in some vaccines. At the moment, there are no vaccines in the United States that use thimerosal, which has a ingredient, and I could be getting this back, or ethyl mercury. And the reason why is because there was some studies that suggested in certain doses methyl mercury, which is a compound that differs from ethyl mercury by 1 carbon, basically was linked to some the development of some neurological problems. Now, the compound is actually completely different in thimerosal. But unfortunately, when the FDA decided to remove it as a precaution, it caused a lot of fear. So there was never any evidence to suggest that thimerosal with the mercury compound was, in the doses that it was in the vaccines that were being used, was linked to any issues. So the answer is no, it's not there, and it wasn't needing to be removed anyways, but it was, and it, caused a little bit of an uproar. Yes?
I'm hearing just from a couple of younger moms talking about the MMR and the MMRV.
Yeah, MMRV is just, the question was about the difference between the MMR and the MMRV. The MMRV contains chickenpox vaccine as well, that's it.
So what is, so is there, so I'm hearing that there are much higher, reactions when they're given together. What's your view on combining them versus not combining?
I actually don't want to answer that question because I'm not a pediatrician and I'm not the one I don't know about the higher, I'm not familiar with it. I mean, when I was a kid, we had MMR, we didn't even have chickenpox vaccines. So, I mean, we just had chickenpox parties and we all got chickenpox. So I can't actually tell you for sure, except for the fact that, I don't know that everybody does it. As a matter of fact, I don't even think that my kids did it. I don't think everybody, I don't think all pediatricians do the MMRV. So yeah, and I can't, again, I'm not a pediatrician. I don't want to answer a question that I'm not qualified to answer. Okay. So wait, you had your hand up first. Did you have your?
I did.
Yeah.
Was autism really the only fear or any other type similar of neurological disorder fear that kind of made this fear of vaccinations? Or is there another reason or other reasons why parents don't want to vaccinate their children?
So the question was, is autism really the only fear that was preventing people from getting vaccinated, right? Was that the question, just sort of reworded? I mean, that was the big one. And I think that autism is sort of, it's almost like an umbrella term that describes an entire spectrum of neurodevelopmental diseases that go from, you know, severe low-functioning autism to high-functioning autism to Asperger's to other nonverbal learning disorder type of things. So it's sort of an umbrella term to describe a lot of different developmental things. So I don't think like the degree of autism or the severity of it, or they had, you know, there was any speculation on that. It was just sort of like neurodevelopmental disorders. So there was another question? Yes.
I'm not sure if you would know the answer because you said you're not a pediatrician. Is it really safe for a 6-month-old baby that gets his first dose to go on a plane to Israel?
Oh, so
I know it's usually 12 months, but if
Right.
you travel, they say come to it when the baby's 6 months. But is it as safe when he's 12?
okay. So the question was, is it as safe for a 6-month-old baby to get the vaccine because he's traveling versus?
Immune enough to go on a plane. Yeah.
So it has some immunity. No, it does not have the same degree of immunity as when you get it when you're older, because your body cannot mount as strong as an immune response as you would when you're older. But also, you know, even when you're 12 months old, the first vaccine only gives you 93% immunity. It's the 2 vaccine series that you get later on that confers it more. And also the 6-month-old doesn't really, like I said, doesn't really have the capacity to mount the same immune response as an older child does. And this is, I'm pretty sure about this answer, but it still gives you some immunity. So, you know, the fact of the matter is that it would be, like, even if they were exposed, I think that the theory is that it would be much less severe if they were to contract it. I just want to leave this slide up with the, this one. Yeah, okay, I'm sorry. Yeah.
You mentioned before chickenpox parties, so I'm familiar with like my parents and also I'm sure some of our grandparents that had measles parties. So if these are things that were happening, like when I was little, I had chickenpox and me and all my cousins, we got chickenpox. Why is it such a concern to mandate these vaccines if we all had these diseases and we all have the real immunity? Why mandate a vaccine on it if it's fine to get it?
So the question was if, I guess when our parents and our grandparents were younger, they were having, you know, they were exposed to it naturally and they developed immunity to it naturally. Why is it being mandated that we vaccinate against it? Because you could develop it naturally and also be immune to it, right? Is that your question? So first of all, chickenpox is, there was no measles parties that I've ever heard of. Chickenpox is a dramatically less virulent disease than measles. I mean, actually,
Today it's mandated.
is it mandated in
Yes,
schools
it
now?
is.
Again, you know, I'm not a pediatrician, but I think that I'm not sure actually. I fill out a lot of forms and they don't always require the varicella, so I'm not 100% sure, but I think it probably has more to do with the fact of why risk the exposure if the downside to getting.
Also, is if you know, there are a lot of children who may be immune compromised who are in, you know, might be in school. So a child who's immune compromised, let's say a kid on chemo, cannot get the chickenpox.
Yes.
Everybody else can get it, but it could be really fatal for a kid
Yes.
on chemo who might be in your kid's class.
Or your grandparents, like people who are
Right.
shingles.
Well,
Grandparents probably had it. Grandparents probably had it, so they're not going to get it again.
Yeah.
No, but I'm just saying,
They
generally,
could have
a lot of these vaccines, where you're
Right.
putting
Right.
other people at risk.
Yeah, so I mean, there's two sides to being, there's two sides to the benefit of being vaccinated. Obviously, one is to protect yourself, but it's also to protect the people who are so immunocompromised that they actually cannot get the vaccine, because if they are exposed to the disease, it is almost invariably fatal. I happen to have one of my good friends has there's a congenital defect in her twins that were, I think, through IVF, and so her kids cannot be vaccinated, and she's terrified. Like, I communicate with her all the time. She's terrified of sending her kids to school now because of what's going on. So. Oh, well, they were born with a congenital abnormality. I mean, this is something that was diagnosed even, I think, when she was still pregnant. Yeah.
To recap, so measles is way more dangerous than chickenpox. Chickenpox is only dangerous to a very small segment of the population, but measles is dangerous to the entire population. Like, they're much more at risk for getting a much more serious disease. Chickenpox generally is not a serious disease. I mean, I had it.
Sure, yeah.
Once in a while, an adult gets it. Once in a while, like a guy, like a 20-year-old gets it, and you can get actually, the chickenpox can actually be inside your throat and everything. Really, it's uncomfortable, but there are no long-term effects. There's nothing really lasting. That it's just really uncomfortable.
Yeah.
Measles, on the other hand, is extremely more dangerous.
Well, it's fatal. It's potentially fatal. I mean, obviously, hopefully not. But the risk of a fatal complication, or as I mentioned before, encephalitis, pneumonia, SSPE, exists with measles where it does not exist with chickenpox. Now, that's not to say, of course it's possible, like there's a tiny remote possibility, and again, I don't know the exact percentages of complications from chickenpox, but it nowhere is near the prevalence or the risk that measles has. So, yes.
So what do you tell somebody that doesn't want to immunize their child? I mean, what do you tell them?
Yeah,
That's what I want to tell them.
It's like they're ready.
They
answers. They're like, do you know, like,
Yeah, you can give the, so the question is, what do you tell people who don't want to vaccinate their kids? I mean, I think that this is, I don't even know that I can give you what I would say, right? But what I would say, maybe a non-medical professional wouldn't feel comfortable saying, but you certainly could try. I mean, and the problem is that it doesn't really matter what somebody says, because if they're already very, convicted in their belief that XYZ thing is going to happen, then it's very hard to dissuade them. Like, if I tell you that, look, there's 25 scientific articles that clearly debunked any potential neurological developments as a result of the MMR vaccine. 25 people since 1998, when he published his study, have repeated the research, and it's not reproducible, and blah blah blah. And you can tell them all this, and you can show them the articles, and they can read it. But in there, like, they're not going to believe it. Like, it's almost like, well, this is a scam, And I've heard that before. This is a scam. This is a governmental scam. And I don't know how you retort something like that, because that's not based on anything. There's no facts to substantiate that. That's a theory. It's an opinion, not a fact. There are, scientific facts. I mean, there are a lot of strong things that people could say that I've heard. I mean, I'm on a physician moms group of 70,000 people worldwide. And this is a conversation piece, not totally uncommonly, on these websites where as physicians, we're seeking support from other physicians on how to, debunk these theories. And it's rampant, the concept that it's bad, and it's very hard to convince people once they've made that opinion, even if the facts don't substantiate it. Yeah.
I just want to state that I was once at a program where a physician, a pediatrician, a woman probably in her mid to late 70s, spoke, and she was at this forum, which was actually medical ethics, and she said, they told me I could talk about anything I want, so this is what I'm going to talk about. She said vaccinations. And she said the most powerful thing, which is, I began my practice when I saw cases of measles and polio. She said, I saw my patients die from these diseases.
Yeah.
Until we started, and then she said, and then I think a year or two into her practice, vaccines became the norm, and she said the plummeting of complications and like long-term side effects and things that children died and were disabled from,
Mm-hmm.
just fell precipitously. And she said, I don't care what anybody ever tells me about anything they show me. I witnessed it personally. I saw it myself.
Right.
And no one can ever tell me that vaccines are not good, because I watched my patients die. And I repeat that many times, because it's a very powerful statement from someone who lived through it.
Right. I mean, the facts are that there was a disease, there was a vaccine that was introduced, it was implemented, and then there wasn't a disease. That's the facts.
Right.
You know, there's really not, you can't really debate that fact. Yeah.
Are any of the vaccines led to any sort of development delays, such as autism or whatever, or specifically just the MMR was tested and proven that there's no connection? All the vaccines checked, like let's say the flu shot or things like that.
Yeah, well, there's never been any suspected link between any other vaccines. And again, this was only brought up by, the question was, is there any other vaccine that's linked to any other neurological or developmental disorder outside of the MMR, and have they been tested? So, I mean, I don't know if they've been tested, but there was never any suggestion of any other link between neurodevelopmental delays and autism and any other vaccine. And the only reason why, again, why that one was even stemmed from entirely from that falsified article in 1998 that was published in the New England Lancet, right? The Lancet, because they retracted it, right? So I mean, as far as I know, the answer is no. But I mean, I can't tell you definitively, because there's never been any association or any link between any other vaccine and any other complication, other than, you know, the minute risk of actually getting measles from it, which of course would be less virulent if you got it from the vaccine than if you got it naturally from not being vaccinated. Yeah.
So going back to your charts here, measles cases by month and by year, and I'm just seeing how, I mean, the cases have minimized so much. I guess now in August over 24, they're going down, which is great.
Yeah.
And I'm not saying that this is positive, but I think a positive that we can take from this is it probably sparked a lot of awareness about the importance of vaccinations.
Yeah.
And I mean, we should never have to deal with so many cases. I mean, 1,200 cases this year, but
I thought I had it up here too,
I know you had
but
it.
there's another number of the number of deaths, and I
So I just, and this is not a good thing, and I'm not saying there's, like, I guess a positive that we can take from this is I think it did definitely spark a much bigger awareness, and, you know, for other diseases.
right.
and things.
There was, I mean, there was a, you know, yes and no, with respect to what the other woman was saying, asking me, like, what do you say to people who don't vaccinate their kids? There's a family in Israel, in Measles, that one of her children got measles and died from it, and she still didn't vaccinate the other kids. So, you know, that's sort of like, I mean, what do you say to that? You can't rationalize with that.
Right. Well,
It's more than that. I mean, it's more than just ignorance. There's something. I mean, you lose a child to a disease that's preventable. Not that your child gets sick, but you lose a child to a disease that's preventable. You would think would, you know, sort of be an impetus to realize that maybe this is not, you know, yeah.
But aren't all, like, I've read the insert for the MMR before I came here, because I wanted to know. And all these things that you're mentioning, encephalitis, deaths, are on the insert for the vaccine as an adverse reaction. So really the chances are both there. So it's either you're gonna get the MMR and you still have those chances, or you're gonna get the measles and you still have those chances.
It's not equatable. You can't equate that because the risk is negligible. They have to, you know, if you take Tylenol,
So the adverse reactions are there because they're just.
by law, you have to say whatever potential side effects have occurred, even if it's, I mean, right. It has, yes, it has occurred.
Over 400 people died from the MMR, so how do we?
I don't think that's true, actually.
I saw it. I saw on Bayer's
On what?
Vaccine Act, I don't know, people like
Yeah.
report.
I actually don't think that that number is true, that 400 people have died from the MMR vaccine. I'm actually fairly certain that's 100% not true.
So these moms just thought it was the vaccine?
What was that?
Like all these mothers that come out and say what happened to them, is it just that it was a coincidence? It's not real?
I mean, perhaps, I don't know, but there's also a ton of people who say that their kid got autism from MMR, and we know that as a fact not to be true. So I don't have the numbers right now for that, but
Like I mentioned the Hannah Pullen case before, but you didn't know what that was. It was a father who was doing studies on his daughter before she got the MMR, so he happened to have had brain scans of her head before she got it, and then just by luck, he had those scans, and then after he took another scan after she got the MMR, and then then you saw the difference in the brain scan, so how do we explain that? And then when the case was in the Supreme Court, and that's when the Supreme Court ruled that the vaccines are unsafe and unavoidable. So like, how do I hear that and then hear other sides, and there's all these sides, what do I know what to believe? How do I know?
okay. I don't know, but you said the Supreme Court decision was that vaccines are unsafe?
Unsafe and unavoidable. The Supreme Court ruled that vaccines are unsafe and unavoidable. So, like, and then the CDC is saying that they're safe and the best thing. So, like,
I don't know. I would have to familiarize. I'm not familiar with any Supreme Court decision that said vaccines are unsafe. That's a pretty strong statement.
I know,
I
it's
think
such
that
a
would have
strong
been on the
statement.
world
But I
news.
think,
Yeah, I think that would have been on the news.
Yeah, I mean, yeah,
Social media can present whatever.
yeah. I don't.
Definitely Google it.
Yeah, I mean, I understand, but I'm pretty sure that there's no. I mean,
From that case, from the Hannah.
so one man in comparison to an entire country of millions and millions and millions of people that have been saved.
He happened to have had scans of his daughter's brain. Like,
Yeah.
everyone has scans of
Right,
their child.
but you can't make a causal link with one case study. If science were based on one case study, no theory would ever be proven. You can't make a causal link in anything. Forget the vaccine, in anything, right? Between one case study and an outcome and say that this is what it is. It has to be reproducible. In other words, the definition of evidence-based medicine is that you can reproduce the results, right? So if one person comes up with a theory and seemingly has evidence to support that theory, and I'm not just talking about that gentleman or that disease, I'm saying anything in medicine. One case does not make a definitive cause. It's impossible to do that. It has to be able to, just like the Wakefield case, it has to be reproducible. The other people have to do the same study and find the same results in order to determine that there's a link between anything, you know? Yeah, you can. Yeah, but it doesn't matter. It could be anything. Maybe that.
Dr. Barkin, I'd like to ask a question because this lecture is also sponsored in part by the Senior Services Division.
Yeah.
Our concern is we, thank God, have a lot of seniors that are over 90 that were never inoculated because they were born way before, that had siblings that came from families of 11, 12, 13 kids.
Sure.
And many of them said, I had one sibling that died from any one of the diseases prior to, okay. My concern now is we're coming up on the season where a lot of people are traveling to Israel.
Right.
And other areas where people are not, there are large groups that are not vaccinated. They're coming back on the plane. They're coming back into the community, not knowing that they're carrying it. And if they have not, been inoculated, been vaccinated, and then they go to the grandparent who is aging, who maybe got over pneumonia 6 months ago and still has a weak system, now they're
Right, so yes, 100%. That's what I was mentioning before. So routinely now we're recommending that people verify that they're immune before they travel. That's the bottom line, is that you should verify that you're immune to measles before you travel. Because if you're immune, you won't.
Then you're fine.
Yeah, then you're fine, and you're not going to expose anybody to it when you come back and hang out with your 90-year-old grandmother. You're fine.
So I have another client. Someone just had a kidney transplant, and I said to them, do me a favor, you make sure whoever is coming into that house, before they walk in the door, have you been vaccinated? Because he will not be able to fight anything off. I mean, and it's not just, you know, your kid went.
Yeah, well, you're immunosuppressed if you've had a kidney transplant. Yeah.
And your kid wasn't vaccinated, and now you're going to visit the uncle.
Yeah.
So, you know, you have to think it's not just me, it's who else am I putting at risk?
No, it's 100%. My cousin's, you know, she's a neurologist, and she was saying, I can't tell you how many people I have in the ICU, that these old, you know, these because the grandkids are coming and kissing the grandpa hello, and they're contracting the flu, and they're old, and she goes, I had somebody die last week from the flu, because this is what happens. This is what happens.
Well, the flu vaccine is a whole other topic of discussion, which I'm happy to come back and talk about, but not right now. Okay.
So I Googled the Hannah polling case, and it most definitely was not the Supreme Court, so make sure that was there. It was some sort of federal court, and they did give compensation because of all the aggravated issues that the father has been through. However, it basically said that she had a pre-existing condition, and the vaccine aggravated the pre-existing condition.
So how
And
do we know if
therefore-
our children have a pre-existing condition?
You could ask your local doctor.
You might have known probably why they had brain cancer.
I mean, it's not a typical thing to scan your child.
The father went online and basically said in a news conference, in a statement, I want to make it clear that I am not anti-vaccines. Vaccines are one of the most important, if not the most important advance in medicine in the past 100 years, but I don't think that vaccines should enjoy a sacred cow status where if you attack them, you are out of the mainline medicine. Every treatment has risk and benefit. To say that there are no risks to any treatment is not true. Sometimes people are injured by a vaccine, but they are safe for the majority of people. I can say that with a clean conscience, but I couldn't say that in fact that vaccines aren't absolutely safe, that they are not linked to brain injury and they are not linked to autism, but I hope it will force, sorry I'm moving, I hope it will force government agencies to look further into what susceptibility factors are out there for children to develop brain injury after vaccination, to look into susceptibility factors of people at risk, meaning that if a doctor is about to give you an MMR vaccine, maybe there should be a pre-screening for the child beforehand.
Well, I think that yeah, I mean, I think that the problem is that they don't really. I don't think that we know as a profession every single entity that exists in the world that could make you potentially susceptible. I mean, you have to go with the numbers. I mean, let me give you another example, a completely unrelated example. I mean, antibiotics. You know, if you go to your doctor and you ask for antibiotics for your sinus infection, you know, you are risking something. You know, certain antibiotics cause tendon rupture, like Z-Pak and or not Z-Pak, but like you have a UTI and you want ciprofloxacin, it can cause cardiomyopathies. It can cause. I mean, you know, when you ask for any treatment from any doctor, you have a risk of the side effects of those medications. So, I mean, my thought would be that if you are, I guess there are certain populations of people that don't seek any sort of medical treatment, then that would be consistent with it. But if you're going and you're asking your doctor for any treatment, for anything, whether it's your blood pressure or your diabetes, which could clearly kill you, right, in many different ways that go untreated, or a stroke or a heart attack from untreated hypertension, or the sinus infection that theoretically, I guess if it got really bad, it could go into your brain. I mean, so you're going to your doctor and you're asking to be treated. If you've read the insert on every single one of those medications, there's a list of like 500, you know, potential side effects, because even if it's like, I forgot what the cutoff is, but like even if it's like 0.1% of the population who experienced XYZ side effect, they have to put it on the insert. So there is no treatment that exists that is completely benign. I mean, it doesn't exist. We don't live in a world of.
MRI and CT can cause radiation, but again, you could discover brain tumor.
Right. I mean,
We're discussing
there's.
exact cases that are proven. People are dying. A flight attendant in Alal died. It's not a question. You need to get the vaccination. You can have side effects. There are stories, but at the end of the day, you have to get.
But you have to look at the numbers. The numbers. I mean.
My husband gets a flu shot every year, and every single year he does it on a Friday. Every single year fever, he's home for a day, and he always ends up getting a flu-like symptom of some sort.
All right.
It's just his body, it's just his life.
Yeah, I mean, it's your
You know,
probably
it's
your
just
body.
But like he knows, so he knows that from having it previously and everything. He's been doing this since before we were dating for 7 years. So like I've known it, and it is check. Ask your local doctor. My favorite, let him see this. Hi, my name is
What?
Emily.
If anybody ever watches, they tell you that if you really want to know about all these drugs that they're advertising, close your eyes whenever they talk about the
Yeah.
drugs.
Yeah.
Instead of seeing people climbing mountains and rowing and having a great time, you say, oh, you could die from this and die from that. Like,
Yeah.
so
Everything.
If
There's
you read the answer for Cipro, if you I was taking osteoporosis medicine. Oh my God, you read some of that stuff. Like,
Yeah.
but my chances of breaking a bone, while doing something normal is way bigger than my chance of getting that crazy hip fracture. And in the end, I couldn't take them anyway because they caused me an ulcer, and that was part of it.
Yeah, I mean, and that, yeah, of course.
How did you get pregnant? What? You still shouldn't get pregnant because of the chance that you could die in childbirth? Like I'm saying, there's much of a chance dying in childbirth as you do getting
What about
autism.
fertility? I've also heard that these vaccines are like causing infertility.
I've never heard that.
Well, I sure would work with me.
Yeah, I think that's another. It's another anti-vax theory that has no basis in science.
There's like a massive law piece against it, but they want to mandate it. How do
So
you explain,
HPV, that's a little scary.
how do you explain stuff?
I didn't actually hear your question. What about the HPV? No, but what was your question about it?
There's a case against it, but now they want to mandate it for 14-year-olds.
I'm not a pediatrician. I don't know. I'm not going to comment on HPV vaccines. I don't know.
There's a lot of emotional baggage with the HPV because that assumes that your 14-year-old is going to have premarital sex with somebody who has virus, which for religious group, that's kind of like, well, that isn't really the way we are. That's not what we expect of our children. And there's the social emotional thing of, well, are we then giving this child the HPV, giving them carte blanche to go do things that we don't agree with?
I don't think we should diverge and start talking about HPV because it's not something I can comment on. I mean, you're welcome. Yeah. That's,
It's a whole different.
yeah, you're welcome.
Very insightful.
Okay.
Just to get us older.
Yeah.
Okay. All right.
Also, autism, I just want to clarify that autism, there is no scan, there is no MRI, there is no EEG, there is nothing, there is no current medical.
There's no way to diagnose autism in some scientific way.
Solely
But
through behavior.
I'll tell you something. Both of my stepchildren have autism. Okay, both of them. 2 teenagers, one more severe than the other, and I have 2 kids with my husband, almost 5 and almost 7. Everybody's been vaccinated because there's no way to diagnose it or know. I mean, I had zero fear of vaccinating my children, despite the family history on my husband's side, because I knew that there was no factual evidence to do it. So, I can't.
They haven't found it yet, they have not found the scan.
Not even genetic testing. We did genetic testing too. There's nothing.
Isn't anything, and they're really looking for something.
And I hope they find it. I'm sorry, what?
If it was genetics, we have
Not if it's autosomal recessive. I mean, there's different ways that genes are. Some genes in general pass down. They're dominant, and so if the parent has it, the child has it, right? No matter what. And then there are genes that are recessive. So if both parents carry a gene that is not a dominant gene, then the child can get it. There's a lot of diseases like that. It doesn't matter. Okay. All right. I think we're good. Thank you guys very much. I really appreciate it. Thank you.